After Asian double eyelid surgery, my creases are too high and asymmetric. What can I do?
Swelling after Asian eyelid surgery can make a lot of people worry about their results. I'll explain how I help my patients for whom I perform double eyelid surgery. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Asian eyelid surgery is often referred to as double eyelid surgery and is a procedure I perform routinely in my practice. This term, double eyelid surgery, can be used to describe both the non-incisional technique and the incisional techniques, which I'll describe further. So what are the main concerns of patients after this type of surgery? Well, it comes down to two issues: swelling and symmetry. Before discussing these concerns, it's important to understand why the procedure is actually performed, what are the principal objectives of this procedure, how the procedure is actually performed, and what the healing process is like before you have a more stable appearance. The goal of this procedure is to create a crease or a double eyelid fold where one doesn't exist. Often there's a case where a crease is actually partially present and the desire is to have a deeper, more well-defined crease. Asians who have a natural eyelid crease or double eyelid have a connection between a muscle called the levator muscle and the skin. The levator muscle is the muscle responsible for lifting your eyelids. The procedure options include, as mentioned earlier, the non-incisional technique and the incisional technique. But the main objective is to create a connection between the skin and the levator muscle. The decision to choose the non-incisional or the incisional method in my practice is based on the presence or absence of excess skin or fat. When I perform the non-incisional method, I make strategically placed entry points into the skin and place sutures to engage the levator muscle and create a connection which results in a crease. When I perform incisional surgery, I close the skin with sutures and use different ways to attach the skin to the levator muscle for the same purpose of creating the crease. Swelling that occurs between the crease and the eyelashes is something that concerns a lot of patients. In addition, the effects of swelling often makes the crease look higher than the desired outcome and make many people feel very anxious. Swelling can also be different between the two eyes, which can also make someone concerned about looking uneven or asymmetric. During the consultation, I educate my patients about the healing process, which includes swelling and timing for returning to work, social engagements, and when to expect a stable appearance. One area of significant concern, especially in the first few weeks after surgery, is the perception that the height of the eyelid crease is too high. I often get asked by patients who have had surgery elsewhere about how soon a revision surgery can be performed because they believe the surgeon had made the crease incision too high. It's important to understand that swelling between the eyelash and the crease is temporary and that it can make the eyelid crease look too high. Typically, my patients go back to work in about 1 week. For incisional surgery, this corresponds with when the sutures are actually removed. As far as social events or events where your appearance is important, allow for at least 2 weeks or more. It's important to understand that swelling can be present and continue to decrease over several months and up to 1 year after surgery. Generally, I expect the appearance to be close to the final outcome or result around 6 months. If a patient has a history of allergies, sinus problems, smoking, or other circulation issues, swelling can persist longer than is typical. If there isn't significant swelling after 6 months, revision surgery, if needed, can be considered. In the first 2 days after surgery, cold compresses help decrease the initial swelling. After the first 2 days have passed, the clearing of swelling depends on the amount of swelling and the circulation. I encourage my patients to be up and about, walking, talking, smiling, and moving. And if they're planning to be more sedentary, warm compresses can help. Swelling and asymmetry after Asian eyelid surgery can be concerning. In my practice, I help my patients through this process by seeing them at closely spaced, regular intervals, so I can make observations and continue to educate them about the stage of healing they're in at the time I see them. I hope you found this information helpful. Thank you for your question.